Good morning. Welcome to Morning Brew with, yes, it's your girl, Germaine. Oh my goodness, we are here. Today is Authors Brew Friday. It's absolutely beautiful outside today. This weather's been really crazy. It's been in the 80s up north, and then next week it'll be back in the 50s and 60s. But you know what? I'll take it. But you know what? I'm going to bring some sunshine to you all today from in the studio. We have a special author in studio with us today, and she is a first time author. Now, this is what's interesting. She's not just an author, she comes out the gate as a number one best-selling author. So I am so excited to bring her on to the show today. But before I bring her up, let me just tell you a little bit more about who she is and pretty much what today's morning brew is all about. So today's brew is it's heart behind the scrubs, how nurse preceptors shape the future of healthcare. Yes, that's the title of her book as well. Let me reframe. That's the title of her number one book as well. Yes, number one in two categories, Kindle and paperback. This is her first time out the gate. So, she is overjoyed, overexcited, and I cannot wait to share her story with you today. So, but let me tell you a little bit about our featured guest today is Dr. Harrieth K. Gabone Siaca Bey. Yes, she is the author of the best-selling book, Heart Behind the Scrubs. And, I just want to tell you that she is such a dedicated nurse leader, educator, and advocate for strengthening clinical education through effective preceptorship. Now, I'm going to have her really break down preceptorship because for those that are not in the healthcare industry, like myself, it was a new term for me. So I have learned so much through this book. And you know what? Let me stop talking. Let me just bring her up in studio so we can get all into it. So hold on one second. Let me bring up our guest. Good morning, Dr. Harriet.
Good morning, Miss Germaine. Thank you so much. I am so happy, excited, nervous, and excited some more.
All the above. I know.
Yeah.
Listen, I could not wait. I was literally doing my morning walk
Mhm.
yesterday, and I said, okay, let me go check to see where the book is in Amazon. And it must have been six something in the morning, and I knew I couldn't call you that early. But I could not wait to tell you that your book, I'm going to pull it up on the screen real quick. So this is the book, Heart Behind the Scrubs, how nurse preceptors shape the future of healthcare. But this is what I saw and I sent to her. So hold on. This is what I saw when I pulled up Amazon. It said with the little ribbons, number one new release bestseller, number one new release bestseller for Kindle and for the paperback book. So, yes, we are celebrating her today. First time out the gate. First time out the gate. I feel like I just
Thank
gave
you.
birth to this book.
I, that's how it feels like it.
It does. Listen, but I want to let me hold on. People are coming into the comments, so I definitely want to make sure I share those coming in. We have Siobhan Rodney. Congratulations, Harriet. Yes. So I'm quite sure we'll have more chiming in, but I want you to share your journey because you didn't just come to me as the publisher, it started before then.
Mhm.
Tell us a little bit about how this book became to be.
Okay. So first of all, I need to say I am grateful. I'm blessed, and my heart is full. So thank you for making my dream come true. And of course, without um, hesitating, I want to thank my husband, Dr. Paranka Siaca Bey, for supporting me and
Yeah,
encouraging me and a little nudge, like you can do it. So
that's right.
thank you, Miss Yellow. But anyway, so I have been a nurse for 26 years, and I started when I was 2 years old, so don't do math.
That's right.
but but I'm excited. I'm always like to learn. My mom and dad, they are both teachers, so they instill in me that the love of learning. So you always don't get enough of what you're learning. So always seek more information. So starting as a nurse, I wanted to be able to know more so I can educate my patients. So I did work at MedSurg, I did work at labor and delivery. So in labor and delivery, the most things that you do with your patient is educate, educate, educate. So that inspired me. I was like, I need to go and get more education for myself to be able to do better for my patient. So of course, working labor and delivery, we started working with patients, and then the patient comes with the babies, and we all know that baby don't come with instruction. So
That's
always
right.
mom is gonna, mom and dad is gonna say, "Oh, okay, how is my baby doing? Okay, how is it gonna? Baby's gonna do this and this." And I'm like, "Well, baby's gonna teach us." So in meantime, I'm like, okay, go back, read the journals, read the articles, and say, okay, I need to know more about laboring moms, laboring patients, and postpartum. So the love of learning did not even stop there. It just kept pushing me to be able to say, okay, I get my bachelor, I get my master's, I get my PhD. So of course, in the PhD, I'm like, I need to be able to inform the population. I need to be able to educate people more in women's health and all the nursing information needed. So during my PhD, I did my research on preceptorship. I wanted to know if you're teaching somebody else who is going to teach a patient and the patient is going to go home, am I teaching them enough? So that voice pushes me to say, okay, I need to know what exactly preceptor knows. I need to know what preceptors are facing, and I need to know what exactly is going on when they're teaching somebody else. So hence I did the research. And with that, I kept hearing different things that they need. So hence, of course, we end up with this book, because doing my research and my dissertation, I realized that was the problem is not only in one area, women's health. The problem is the whole hospital. The problem is all places that they're requiring these new people to, I mean, when they hire new people, they have to come and train them. So when you do that, the person who is training, the person who is working, they need to know a little bit more than that. So how do we measure that they know? By listening to what the preceptor does. So hence this book came about. I'm trying to share that, to bring it outside the four walls of the hospitals, to make sure that people know what actually preceptor means and how does that affect a regular person at the bedside. If the preceptor knows what they're doing to teach the nurse who is going to take care of you and make sure you are safe and go home.
Listen, it was definitely a new terminology for me, because when I remember our first conversation, me, you, and your husband, we were on a Zoom call and we started talking about your dissertation. And, for those that understand a dissertation and what that is, it's heavily researched information, you know?
Yeah.
Factual information, very detail oriented. And so you're right. Your husband was definitely, he was 100% supportive and pushing you forward. And he said, nope, we're going to do her book first and then we'll do mine. Well, this is the funny thing, because your book was with us, your husband was with us in studio last Friday, because he was a part of a men's anthology book that also hit the
Yes.
bestseller list.
Yeah, I know. I am so proud of him and everybody else, definitely. And Dr. Teneya, she
Yeah.
did an excellent job. Yes. Mm-hmm.
And so both of you are in the house as best-selling authors and first time out the gate, which is so exciting. But a lot of people don't know. You can definitely put all that labor. And I can't say I know exactly what your experience was going through a dissertation, but I work with a lot of people that have gone through their dissertations, and my heart goes out to them. Absolutely.
It's a lot of work. It's a lot of
It's
work.
a lot of work.
And for people who are doing research or trying to do their PhD or DNP or whatever the program you want, always find a subject that interests you. When it gets hard, that your love of that topic is going to carry you over. If you do something just without thinking, it's going to get hard and you're going to give up. So always find something
Good
that you're
advice.
passionate about it, because it's going to push you those dark days, long hours, long nights.
That is good advice. Make sure
Yeah.
you love what your topic
Yes.
is about. because that will be
Exactly.
the motivation you need when you run out of steam.
Yeah, and you will run out of steam.
Absolutely. So I
Yeah.
am just so excited to be a part of your journey. With you being a newbie, a new author, and not new to writing at all, because I mean, her dissertation, it took a lot of long hours, a lot of research, a lot of writing.
Hmm.
But the interesting thing is when she came to HOV Publishing and she had this idea that I want to turn my work into a book for the everyday reader to really get the message out there. Because one thing that I've discovered, preceptors are unsung
Here.
heroes.
Yes, exactly.
Nobody's talking about a preceptor and
No,
all the work.
no.
So that's the one thing I've discovered in working with you with this book. They are
Mhm.
definitely the unsung heroes. They need to be spotlighted. And the title is so befitting, that nurse preceptors are really the ones helping the future of the healthcare industry, because
And
you're educating everybody.
exactly. And so I always, when I see Days Award, I see Employee of the Year, I see a lot of accolades are given to everybody else except the preceptor. So always my thought, because I love preceptorship, always my thought goes to, like, that person is becoming a Days Award is because they have a great teacher behind them to make sure that they are doing what they're supposed to do and save somebody's life, until the family members see that nurse and say, oh, thank you so much for all you do. But my thought always goes to the person who trained this person to be this good. So we need to give the credit also for their people also, because they're
Absolutely.
always behind the thing. They don't say in a word, they go and do their work without even screaming out there, but nobody is going back to say thank you for training the trainer.
I think that's why this book is so important,
Yeah.
because one, it brings the spotlight to preceptorship.
Hmm.
Also, it acknowledges those that have a heart to educate and to teach, to
Yes.
be able to go
Hmm.
into this space, knowing it's a humbling experience, it's a lonely experience, it's quite, and really you're going into it because your heart is postured towards helping people and not just accolades, because as you just
Hmm.
said, that's not one of the things that they really acknowledge.
No, no. So the other thing is, I know when I was doing my research, and also in the process of writing this book, it always comes in my head when I'm talking to somebody else and I said, oh, I'm talking about the precept, but like, what is that? So I know that it's terminology is used in the hospitals environment or healthcare environment, but that terminology can apply to any place that has any clinical practice. So meaning, like, any new hire comes in, the person who is teaching that new hire is a preceptor. So you might call
Okay,
them different names. It might be a mentee, it might be a coach, it might be, but that person is the
that's good
preceptor
to
for
know.
that new hire. So then the definition for the preceptor is always is somebody who is bridging that gap from all the technology, all the knowledge, all the clinical practice to transfer to this person. That person go and do that clinical work. So preceptor is like a middle person there. As I said, they're
Okay.
always unsung heroes. And then so it's not only in healthcare, even in school, the person can be precepting somebody, being a mentor of somebody. Is because you are helping this person to gain some knowledge or clinical knowledge to be able to function effectively in that new role. So that person who is teaching you is a preceptor. You might call it different things, but also their subjective role is to make sure they are preparing the next person to work to the next new role. So
That's good to know. It's really good to know, because there are so many people that probably feel undervalued,
yeah.
unappreciated for
Hmm.
all the work that they do. But I always say our rewards come from above.
Yes.
Because if we wait on man to give it to us, we will be upset.
Yeah. So I will give you a simple example. When
Hmm.
I started working as med-surg nurse, and after a few months, then you are getting a new hire to come and work with you. So Of course, I love what I did, taking care of the patient, making the patient comfortable, and of course, addressing the challenges and try to educate the patient and the family members. And of course, communicating with the doctors. So you're kind of like in the middle person there. So when you get a new person, whatever I know, I need to make sure this new person knows what I know and be able to go and function and provide safe care for the patient. So of course, I was like, love to work with somebody, go, let me show you. So of course, I'm showing stuff. And then after a while, I have 4 other patients. So I
Exactly.
start getting anxious. Then like, okay, I need to pick up the speed. So doing that part, that's all the same thing that I know the preceptor are experiencing. And I'm sure people who are watching or listening to your show right now, if they're preceptor, they will agree with me that a lot of time that you do a lot of things without anybody acknowledging. So you train one person, you go and train the second person, you go, the third person, the fourth person, the fifth person. So remember, nobody comes and say, okay, how do you like about precepting? Nobody comes back and say that.
Exactly.
The next time, the next time they want, they're gonna come and say, go ahead and do. There's a new hire, or sometimes you just show up at
Exactly.
in the morning, and the new hire is right in front of you, smiling, excited to work, and you're like, oh. And yeah, so there's a lot of challenges, and that's why I did my research and this book is just to shed the light, like the person who you ask over and over and over to train others, can you give them some little love and say, okay, you know what, thank you for what you are doing, okay, we're going to give you a little break, we want to hear what is the
Exactly.
suggestions to make this process better, so at least they can be valued enough to say, I enjoy teaching, then I can subject myself with this stress and straining of work to be able to teach somebody else.
Do you find that a lot of people, even that's in the space of, we'll keep it to nursing, that want to go into the area of preceptorship to help? Because the one thing you just said, it sounds like there's also double work that you do, training and supporting your patients.
Yes, so with it, people who love to teach, they will be willing in the beginning, excited about the role. I can teach somebody else, I can work with somebody else. They will enjoy as long as you also support them. Meaning, like in working, I'm going to give you an example. These are just numbers for discussion purposes. So let's say one nurse in a unit can take care of 2 patients or 3 patients. So that's a normal workload. So when you get a new hire, you might still have those 4 patients. The problem with that is, if I'm the only person who's taking care of this patient, I can just go quickly and do my assessment, medication, care, whatever, and then I keep going to the next. But you have a new person, I need to slow down, sometimes even double the time to make sure that I have enough time to explain. So that means in healthcare, that's 5 minutes, 10 minutes I don't have, because I have other patients I need to see
Right.
before 9 o'clock. So it adds more work versus if we were trying to support that preceptor, instead of having those 4 patients, can they have 2, maybe 3, when they're getting to the new
Exactly.
hire knows how to do it. So then at least they'll be able to spend the time, educate, because you have to slow down. And especially if you're allowing the new hire to demonstrate the skill, they're going to take longer. So that means you're going to have a delay with your work. And then so that add more stress to the preceptor, because I need to do this, I need to do this, I need to do this quick. And it's a lot.
It's,
It's a lot.
I'm sitting here and I'm thinking back over 5+ years ago when we all experienced COVID, and just how that shook the healthcare industry up so much. And then the
Mm-hmm.
turnover of people that were passing away, because talk about unsung heroes. You all
Yes.
in the healthcare profession,
Mm-hmm.
especially frontline workers, were
Mm-hmm.
truly the unsung heroes. And I know you probably witnessed and experienced so much loss, not just from people, not just from losing life, but also from people that were burnt out and just left the industry. Did
Yes.
you see that happening a lot?
Yes. So that time I was also teaching at South University as a nursing professor. So it did affect us to a point that we didn't have clinical hours. So we couldn't take the students to the hospital. So we have to do work at the school. So and I have a lot of friends who were working at that time in the hospital area or clinical area where some of them lost their lives. So there was just so much stress at that time, a lot of turnover, because some people could not handle that. Either they have a loss in a family member, so they have to go and take care of it, so they have to quit their job. So that means if the job was assigned for 10 nurses, now it becomes only 6 nurses. So those 6 nurses have to absorb their work for 10 nurses. It's going to be so much stress.
Oh,
Also, that time we did not know that, this COVID is going to affect us. How? I mean, people lost their family member, people lost their kids, people lost their spouses.
exactly.
I mean, it was a lot of stress for the healthcare worker. Yes, they eventually provided support. People will have all those programs that supported the nurses, but that was one way. But still, the trauma, the stress, and the loss is still there. Even some people have
Exactly.
PTSD right now because of that. So it was a very challenging time for nurses, and the healthcare workers in general. But and of course in the world, but still on the healthcare workers side, it was a challenging time. And that part is definitely motivation that you really, really love
Absolutely.
nursing, because you went to work knowing the danger is there, but still the love to care for others more than to care for yourself just was
Absolutely.
shown to every single healthcare worker at that time. And it was commendable. It's just, I can't even think about that part anymore.
Exactly.
Because it
Exactly.
is
Thank
so
God getting
stressful.
on the other
Yes.
side. Thank God
Mhm.
getting on the other side of it, but so much loss. And I know, I've spoken to some nurse professionals that they found the burnout rates is
Mhm.
just, and you talk about that in the book.
Yes.
You want to just share a little bit about that? Just the
Yes.
level of burnout. So it has to be a passion and a desire of yours to want to serve others, to be in
Exactly.
this line of work.
So yes, so speaking of the preceptor on the middle of all these things, so the work of the preceptor is, as I said, you have one, either it depends on which unit you're working on. So you might have 2 patients, 4 patients, 6 patients, whatever the patient nurse ratio. So
Mhm.
as you are precepting, you're going to have another person that you have to actually think twice. So I'm going to think without saying anything, but now if I'm working with somebody, I have to think out aloud actually. So the person will learn the critical thinking process. What question do I ask myself? So I can explain just as simple things. How do you feed the patient? Okay, you actually make sure the patient is sitting up. The patient, you hold their left or right hand. You assess them if they have to swallow. So remember, I can do those things without even saying to anybody else, and it can be
Exactly.
fast. But now I have to teach somebody else. So if you keep teaching people and the turnover is so high, you keep teaching every single month, 6 months, you're still teaching and teaching. After a while, you get so tired because you feel strained. You want to do the best for your work, but then you feel like you can't do enough because you don't have the time. And that's why sometimes the people, majority of the nurses are very, very critical of themselves, because we want to do better. We want to make sure the patient is safe. So straining ourselves, thinking, doing more than what is comfortable, beyond our comfortable level, then we strain ourselves. We are stressing out ourselves. We burn out. And then so a lot of people, even if they are in the profession, they are 20, 25 years, they could have worked even to 35 or 40 years if they could, but the burnout was so severe that people were like, you know what, let me just retire now. So it was a big deal, because now the nurse shortage increases tremendously.
Exactly.
You lose the people who are clinical competent to take care of these high acuity patients, because people are saying, I can't do it, or they get sick because of that being the job. So
Exactly. And
yeah,
and it doesn't take away from their love for servicing other people. It's
hmm,
just we're human,
yes,
and sometimes it could feel like you're a robot just being worked, 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 worked.
hmm,
And it doesn't help if you're not appreciated for the work that you do, and
yes.
that's not why you do it. But every so often, it's nice to hear you've done an amazing job, you know?
That's true. That is true. And also for those people who are the preceptors, they're precepting all the time. So that's why to reach a point, they said, I don't want to do that anymore. So with that, the challenge comes now. You have newer people in the unit who are not, when I say the newer, means like a less time, maybe less than 2 years in the unit. Even if they're competent for what they're doing, you are asking them to precept somebody. So the problem comes is, yes, they're going to be able to precept to show them what they're doing every day. But somebody who was there longer and who are competent, who have been trained to be a preceptor, actually have the skills to teach, is not there. So
Exactly.
yes, I can show you what I'm doing, but could it be better? Probably yes, but you don't have that experienced person because they're burnt out or they don't want to do it anymore. Yeah.
Exactly. Exactly. But, thank God people are always being raised up with the heart
Mhm.
to help
Yes.
others. So you're
Yes.
always, as long as you're going to stay in this line of work, you're always going to engage new minds, you know,
Yes.
and teach new nurses through preceptorship. So this is what I've done. What I've done is, and I'm going to pull the cover up, and I love the shirt. I love the cover of the book on the shirt. Yes. Yes. I love that. So after really going through this book, and the one thing I want to say to all those out there, even though this book was birthed out of her dissertation, you will never know it was a dissertation, because we transformed this to really feel like anybody that picks up this book
Mhm.
can really get the heart of those that are in the scrubs, the nurses, the preceptors that are really going through. And what we did do is make sure that in the back you can see all the references where all the information is documented from, but it really reads like a story that invites you right in, and you feel like you're a part of it. And clearly, immediately, you'll be able to identify someone that's in your household, loved ones, friends that somehow, some way may deal in the healthcare space. So, hold on, I just saw a comment come in. Let's see. Gilbert Gabone, 9140. Congrats, Dr. H. Great show. Yes, let me
Thank
just
you,
pop that up
brother.
on the screen also. So
Yes, thank
I
you.
did put in the comments, I put the link so people can
Okay.
click on the link. I'm going to pull the book up. People can click on the link and they can go get their copy. If you have anyone that you are connected to that are in the healthcare profession, especially nurses, or even patients, those that are maybe a patient in the hospital or facilities, definitely you need to purchase this book, a copy of this book for them. So you get an insight also in how this all works. Because, like for me, I was a student. I may be the publisher, but let me tell you, I learned so much from my authors that are publishing their stories. That's why I'm always talking about the power of one story. The power of one story, because now you've enlightened me, you've educated me, and now I have a new terminology. So even
Yes.
when I'm engaging with some of my friends that are nurses, it's like, okay, I feel like we could talk about something.
So I agree with you. Yeah. So the background of the book is my dissertation, but however, the reason that we put this information in the book is because I wanted to almost everybody in the this world to be able to understand. As long as you've been in the hospital, you've been a patient, this
Mhm.
book affects you. It affects you in this way. So if you go to the hospital right now and then you go through the emergency room or you're going to have your baby or wherever the situation is, there is a person who taught that person receive you at the hospital. So if they come and do the vital signs, if they come and ask you questions, if they come and do an emergency response, maybe you had, unfortunately, you have an event that require emergency response, and some people come and save your life. This book is for you to understand who taught those people who came to respond and save your life. Those are the people that we are talking about. Yes, when you thank the people in the hospital, you are thanking people who are primary individuals who came and take care of you, which is great. We are very good in what we do. Thank God for that.
Yes.
But also remember, there are some people who are teaching those people. Those are the ones that I'm talking about, that we do need to give them voice. We need to thank them, saying,
And
thank you for your work. And we need to be able to listen. So part of the dissertation recommendation was like definitely for the leadership and management to be able to say for those preceptors, thank you for what you are doing. How can we accommodate the concerns and issues and stuff? How can we address those things? Once you address that, people who love to teach, they're going to teach every single person they have in front of them, and they will do a good job because they're excited about it. They're willing to do it. And not everybody can be a preceptor. We all know that part. Yes, not
ah,
everybody can be a preceptor. So I will give you an example. So
yes,
if
please
I,
do.
yes, so if I am good at what you're doing, I can save my life. I can do everything, which is fine. But probably is I don't know how to work with somebody else who does not know what I know. So they come and ask me a question. I have two ways. I can respond in kind, or I can be like as obnoxious as I can. I know it all. I'm not teaching you, or I make your environment difficult. So that's one way. That person can, the preceptor cannot be that person who is not willing to work. So the always softer definition for a preceptor is the person who is willing to teach regardless of their clinical competence, clinical levels. Because I can be 10, 25, 26 years of all this clinical experience, but if my attitude toward teaching somebody else is not good, I do not deserve to be a preceptor. So you
That
can have 2 year person experience with still they're learning, they know basic things, but they're learning, but they want to teach somebody else. As long as they know where to find the resources, they will be great preceptor. Because somebody who is new, I want to learn, I'm going to ask you questions. If I create environment that the person can ask me a question freely, or if they fail, they make a mistake, they come and talk to me as a preceptor, that means I am successful to be able to create that environment to foster that growth, to make
good.
sure that person is going to be the next generation. So not everybody can be a
That's
preceptor,
good.
but a preceptor is somebody who is willing to teach the next person and humble
That is
themselves.
good. Let me tell you, that's good because I was going to ask you, what are the requirements for becoming a preceptor? And the one thing I
Yeah,
kept hearing, it is establishing and creating an environment that is
environment.
safe to be able to teach and for people to be able to learn.
Mm-hmm.
And like you said, the title of the book says it itself.
Yes,
Heart,
heart
it says
behind the
heart
scrubs.
behind the scrubs.
Scrubs.
It's a
Mm-hmm.
heart issue. It's a heart matter,
Yes.
right?
Mm-hmm. Mm-hmm. Exactly. So, I mean, a person is going to learn if they feel supported, they feel the love of that environment, they can sense what you are doing, that they feel comfortable enough to come and say, you know what, I don't know how to do this. And they still feel okay to tell you that,
Yes,
because you don't want to be a preceptor that you create the environment that people are scared to come and ask questions. You don't want to do that, because
absolutely.
if you're scared, how are they going to learn? They're going to say, oh
Absolutely.
yeah, I know, and then they're going to make a mistake, and then of course that's why it's going to find out on the patient care that something not nice was done. So we don't want to do that.
Not at all. And you know what? Listen, if anybody talks to me, I'm always saying become the master asker. And if
Yes.
someone's going to shut that down in a space, then you can't ask questions. So you're
Yeah.
absolutely right. You have to be
Yeah.
open, So if you are interested in being a preceptor, you must have an open heart, you
Exactly.
know, make the atmosphere conducive for learning because
Yes.
people are excited. They're stepping into
Yes.
a new space. They have all
Mm-hmm.
this zeal, this energy, and they feel like they can take on a world.
Yes. That's true. And the preceptor does not have to be like know it all. No, the preceptor
Exactly.
is somebody who is willing to learn, find information, make yourself better, and then go and teach. And usually, I believe if I'm teaching somebody else something, I learn even more than the person I'm teaching, because I can't have to go and keep asking myself, why did I do that? Why did I choose that policy? Why did I follow that guidelines? So if I can answer those questions, it's going to become easier for me to explain to somebody else. So
Yeah,
then, meaning like the preceptor, you have to be willing to learn yourself. Go and share what you know with the person and give them the room to grow. And always, they always
absolutely.
like, okay, yeah, when you see somebody you taught and they go and actually do something and save somebody's life, you become a very, very proud parent.
But you know what? That's the thing. There's a connectivity, and you feel
Yes,
like, yes, this
exactly. I
is a
contributed.
child of
Yeah.
yours that you're
Mhm.
helping to navigate through life.
Yes,
That's so
definitely.
important. It's relationships. It's so important.
Yes.
It's community that you're building. You're
Hmm.
providing a sense of belonging as well
Yes.
to
Hmm.
people. So I
Yeah.
want to say also, Gilbert Gabone, I'm going to answer Gilbert's question. I pre-ordered 2 copies of the book and cannot wait to read and ask more healthcare professionals to buy their copies. So great job again, Dr. H. Also, Cecilia, let me put some of this up on the screen so I'm not just reading. Love the show as well. Thank you so much. Thank you for stopping by for coffee and being a part of the conversation, right? Today I'm actually drinking water. I'm detoxing today, this week. I'm detoxing from coffee this week, and I do miss it. Um, but I do want to tell Gilbert that yes, the books are on the way. They will be arriving between the 21st and the 24th of next week. So definitely when you get your book, make sure, I always want people to do like an open package. Take a photo, hold your book up, send it in. Yes, share that with Morning Brew with Germaine so we can share with everybody. But we also have a message from Cecilia Calamabu. I'm so bad with names. So
Calambo.
please, Colombo, great.
Yes.
4875. Good job, Dr. H. Gabone. I can't wait to read the book. I'm so excited. I can't wait for y'all to read the book either.
Thank you for your support, guys. My heart is full. Definitely. Thank
Yes,
you.
yes. What a great job. Like I said, this book, everyone in healthcare should actually get a copy of this book. If you have not received, if you have not pre ordered, the pre orders are over. The book is actually live. You can click the link. You can click the link that's in our comments right now. It's available everywhere, Amazon, Barnes and Nobles. Um, because it just came out. The book literally just came out. And that's why we are so blown away because the book just came out. And literally the next day, I got to put this up again. Let me put this up on the screen again. The next day, this is what we received. Number one banners, right? Through
Yeah.
Amazon. And so, but it's definitely an exciting time for new authors that everybody has a story to tell, but it's really up to you what you want to do with it. And the great thing is, you never know how the story is going to show up. She had already did the heavy lifting. She literally did the heavy lifting. How long did it take for you to do your dissertation?
I did a year and a half.
A year and a half. She's
Yeah.
an
But
overachiever.
usually
Listen, I'm convinced. She's an overachiever. I love it. I love it. And that's why she's so perfect to be the one to author this book, you know?
I want it to be done. That's it.
That's it. My motivation was to be done.
Yeah.
So,
No, but I was blessed when I did the dissertation to the hospital in where I worked. I had a lot of responses from the nurses. So my time to collect the data was
mhm,
short and tremendous because I was looking for about 100 people. Then yes, I got them within 3 weeks. So I was like, I might
but
have started that analysis right then because they were eager to give the information, which I understand and I appreciate that
yes,
part because I learned so much from their feedback to know what exactly the focus should be on the preceptorship. So part of their feedback for them was um, to attend the structured preceptor class versus
oh,
non-structured.
this is how
So
this is how you were
that's
getting your research, right?
yes,
I love it.
exactly. So I realized I'm like almost 20% of the people only who are precepting, they were attended the actual structured class. So 80% were precepting without the structured instruction.
Okay.
So that's a big deal. So because there's a lot of, as I said, not everybody can be a preceptor. Second, when you're precepting somebody else who either make a mistake or is slow learner or slow in acquiring the clinical skills, there's a ways and techniques to be able to move them along create an environment for them to be able to adapt and learn something, versus like being, like a military, like blue and gray, but that's it. If you're not getting it, then get out. No, you have to create that environment. So those techniques, or teaching technique, can be taught in the class. So people who did not attend those classes do not have that skills. So they are doing from their clinical experience, which is great. As I said, if they're doing themselves the work, it's great. But if you're teaching somebody else without the teaching tools, it's going to end up not creating the environment that is conducive for learning. Hence, you're going to let people at the end of orientation, they quit because they're like, I can't take this anymore because it's too much. Yes. So, I mean, that's why I'm really, really pushing for letting the preceptor give voice for their concern. They know better because they're the ones who are working. So hearing them empowered me to know what are the areas that we can structure their training, what are the areas that we can talk about it. And there's just a lot of examples that we give through the book that exactly bore from the feedback from the research. And of course, I continue doing research, and everywhere I go, I continue doing research because the different population give you different responses, and then we learn from the responses.
Definitely. Yeah. Listen, you are definitely an authority in this space. And, by you publishing a book, it helps to solidify that. And you just have such a passion for it. You light up when you talk about it. You do. It becomes like a magnet. You attract people to you. So
I love my students when I'm in the class and asking them, bring them to the clinical area, and then start talking about the clinical care and learning. And then when I get so excited when I said, "Oh, I was able to do blood pressure," I'm like, yes. It sounds like a very simple thing, but for somebody who is a new nursing student wants to learn something, and then you show them, and then at the end of the day, they're like, I did it. I got it right. And I'm like, yes. So those little moments,
they make all the difference.
Oh, they do.
They do. They really do.
You have to love to be a preceptor to be able to do that. Preceptor is hard. It's not a simple thing. It is hard because you are teaching people who have different personalities, different clinical experiences, different projection of what they want to do. So as a preceptor, you have to kind of sometimes you have to wheel them back and come back, and this is the focus. Let's do it. Yes. So as I said, hearing what the preceptor will tell you, they will tell you there's a lot of stuff. It's not only just the clinical skills. The clinical skills, they know what they're doing. It's just that mentoring part. How do you do it? How do you keep people in line to make sure that they follow the rules? No shortcuts, because you're going to affect the patient's safety. So and that's what I'm saying. For this book, is for everybody. You don't have to be a healthcare worker to get this book. Everybody. Anybody can get this book because it will give you the insight of what is happening when you show up at the hospital. Yes, you show up on a different discipline. Like we give examples of even like the engineering. When you get a new hire there, the person who is teaching the new hire is a preceptor. You might use a different terminology, which is fine. But it's a preceptor. It's just somebody who is showing the rope, how to do things effectively and competently in that area. That is a preceptor. So it can be anywhere else.
So it can literally tie into different industries.
Yes.
The concept, the process of it, you're just changing industries. So
exactly. Yeah.
Listen, I have some more. I have another comment, and thank you over on Instagram. Ayat Katie 1. Please charge it to my head, not my heart. I tell you, when it comes to names and the different handles. But I also thank you so much for joining over on Instagram. And I want to say here on YouTube, I'm going to put it up on the screen as well. We have Melissa Haley. Congratulations, Harrieth. I am so looking forward to reading this. I am so blessed to work with you and learn every day. Lots of fun too. That is good. That you keep it fun. Listen, learning
thank you, Melissa.
It is fun.
Yeah, it is. And I said, I mean, if you don't enjoy, it's gonna show. And as I said, just put yourself. I always say, asking people two things. One, put yourself as a new hire in any industry, just a new hire. What type of the person do you want to show you the rope on that area? Yes. And then, so if you have that definition in your head, So think about that definition when you are experienced on that area, and then somebody else is asking you to teach a new person. Whatever you wanted people to do for you, just do for them. Then you can see it will show, and it will be like, yes, you can do this, you can do this. So always do something good for others.
But you know what? I'm so glad you said that, because that's just in life. You
Mm-hmm.
know, whatever you show up to do, to put your hands to, do it
Mm-hmm.
with joy. Do it because,
Yes,
you know, you never know how you can change a person's life that may encounter you, you
exactly.
know? So, I mean, I'm quite sure there are a lot of students that have come through and they think about Dr. Harrieth. She was the best, you know? Oh my gosh, I am so happy. Did you get, listen, this is where you need to go to learn. Dr. Harrieth, right?
And
Yes,
I do enjoy what I do. I do enjoy it.
that's
So
a plus.
yeah.
That
And
is
I always learn more, especially for the new hire or new students. They come and ask me a question. And then if I did not know, I will go so fast to go and find the answer. I'm gonna make sure I come back and give them. So it's always an opportunity for me to learn, hearing other people's thinking process and how find
absolutely.
ways to make it easier for them to understand. If not, if I explain and they are not getting it, I need to go back and figure out ways, demonstration, find a similar story, find a
Mhm.
scenario or something to try and make sure that whatever I'm asking them to do, they do understand, and then they can take over and go and teach somebody else.
But you know what that also shows also? You said it earlier, you don't have to have all the answers. But
Mm-hmm.
long as you know how to tap into the resources to get the
Exactly.
answers,
Mm-hmm.
it makes you even a greater teacher. So, all right, listen, because I know you are at work and you took the time, and I am so appreciative that you took the time to join me on Morning Brew. But I want to ask you this last question, pretty much as we bring it to a close. What do you hope this book does, not just for nurses, but for the healthcare system as a whole?
It's a loaded question. So one of the area I'm hoping people, after they read the book, first of all, they understand the extent of who is a preceptor and what their role in healthcare or whatever their discipline is. Second, I want to be able to ask the management, leadership of the institution and the hospital, whatever it is, think of those preceptors that you are asking to teach your new hires, to provide the education, demonstrate their skills, use their time to teach somebody else. Support them. Ask what they need, what they are lacking, what could make their job easier. Once that you support them, you will see the difference. You will get the result that you want. The orientee or the new hire is going to be the happiest person there, and they will never leave because now they are trained appropriately to stay there and work because they got the greatest preceptor. And
Yes.
then another thing, I'm talking to the preceptor one on one. I know, guys, you work so hard for this role. You are asked to do so many things. But if you do love to teach, hang on there, find resources to try and support you, do professional development, things that will make you more clinical expert to a sense that you can teach somebody else. You can follow the guidelines. It becomes a second nature for you. Once you are that stable on that role, it's going to be easier for you to teach somebody else, and you'll be able to do better and then enjoy the role. And then, of course, you enjoy your career. And of course, lastly, I want to be able to see, is it okay if I can read the poem
Yes.
for them? Yes.
Yes.
We wrote this poem so we can, let me see, sorry.
Absolutely.
Okay, so this to my fellow preceptors. So to the preceptors, the quiet, steady hands, the patient voices, the guides who shape tomorrows while carrying the weight of the today. To those who teach in moments when no one is watching, who steady trembling learners, who give courage away as freely as breath. To the hearts behind the scrubs, your wisdom, your honesty, your unscreened sacrifices are the pulse of this profession. This book listens to you, learns from you, stand because of you. May these pages honor your voice, renew your strength, and remind every reader that change begins with those brave enough to lead it. And this is for you.
I love that. I love that. And you know what? They can find that in the book.
Yes.
Yes. That's just such a token of appreciation to really acknowledge preceptors. You know what? As you were talking, you know, me as a publisher, ideas are always coming into my head. And so I'm going to meet with you off, you know, we're going to schedule a time so I can meet. So book number 2 is going to really, I'm speaking it into existence, is
Yes. Amen to
really
that.
is really going to allow you to bring the spotlight and celebrate preceptors. We're going to talk about that.
Okay. And I know that listeners, the viewers you have, there's some of them are preceptors. So
Yes.
yes, stay
I'm
tuned.
working with someone right now. I'm working with someone right now on their book, and she shifted from the nursing to now the teaching side of it. So she's a preceptor teaching. You know, I wouldn't have known
Exactly.
that if I didn't do this
Yeah,
book, though.
I know.
I would not have
I know.
known. So I
Yeah.
appreciate you so much. And yes, we at Hope of Vision Publishing, we are celebrating you. We're going to help get this book out there to the masses. It's for everybody, everybody. And yes, we're going to meet because, listen, you are pregnant with so much more. I just see you as a leader in this space to really be able to bring the light, to really acknowledge those unsung heroes. I just see you radiating light in this space to be able to do that. So all I can say is strap in and get ready for the ride, right?
No, thank you so much. First of all, I need to say a quick thing, closure. I appreciate you for your understanding, patience, and following that role, changing that to make this book the voice it is. And as I
Yes,
said, this book is for everybody out there, but specifically for the preceptors who really, really, really work and strengthening, especially for the healthcare workers. Definitely, without a preceptor, effective preceptors, we're in trouble in healthcare.
we're in trouble.
We're in trouble. But yeah,
Definitely.
we appreciate all you do. We appreciate your voices. So keep speaking. And then somebody's going to end up listening and things will change. And thank
Absolutely.
you.
You never know the seeds that you're going to be planting. So they'll
Yeah.
be able to go. Listen, if you did not catch it from the beginning, you can always go over to YouTube, Morning Brew with Germaine, and you can definitely find Dr. Harrieth Gabone Siaca Bey. You can find her full interview and you can play it from the beginning. Like, subscribe, make sure you get your notifications, and stay tuned because you never know what else she's going to be doing next that she's going to be sharing in the space of preceptorship. So stay tuned. I am putting it out there as we speak. I just see it for you. I see that for you. So real. It's like so real. So
Thank
thank
you.
you. Thank you for taking time. Listen, guys, we got to let her
Okay.
go back to work. We got to
Okay.
let her have a great
Okay.
day.
Bye. Thank you. Be blessed. Yes. Thank you.
Yes,
Bye.
yes. Thank
Bye.
you so much. Oh my gosh, I love her so much. Yes, what an amazing voice. What a powerful story. Make sure, listen, this conversation is a reminder that impact doesn't always come from the spotlight. Sometimes it comes from the ones doing the work behind the scenes, as she expressed. So if this message resonated with you today, listen, the link is in the comments. Make sure I'm going to put up the book cover again. Make sure, oh, that's her bestseller. I'm so proud of her. Yes. But definitely make sure you look. I still got you in screen. All right,
Oh,
y'all. I'm gonna let her go. I've been holding on to her. Make sure you get your copy. And if you already have purchase a copy for someone else that can really be blessed by it. Okay. And so at this moment, to acknowledge someone who has poured into you. Listen, purchase it as a gift to the preceptors that you may be aware of that are the unsung heroes, and people are not giving them, the acknowledgement or their flowers. Please make sure you do that. So I want to put up on the screen because Siobhan Rodney, it was beautiful. It was a great talk. Thank you, Germaine. Proud of Harriet. Thank you so much for the love, for stopping by for coffee and conversation and being a part of it. So, listen, at this time, we're going to just do our quick final sip. But once again, in the comments, the link is there. Purchase it for a preceptor. Give it as a gift for a preceptor, right? And help support all that they do. So it is well worth it. All right. So in our final sips, the future is not built overnight. It is built through people, through teaching, through patience, through purpose. So today, I just want you to sip slow, honor the journey, pour into purpose, invest in someone else with a copy of the book, and share the brew. Celebrate those who shaped you. Powerful. Thank you so much. And we will be back. Have a safe and wonderful weekend. We will be back on Monday. Morning Brew with Germaine, Monday through Friday, 10:30 a.m. to whatever time, right? But I look forward to seeing you stop by for coffee and conversation. Have a wonderful, safe weekend. Bye now.